Mood disorders, such as depression and bipolar disorder, are so common that we've probably all heard of them. However, there may be certain misconceptions when it comes to discussing these disorders. So, let's dive into the world of mood disorders and explore the differences between depression and bipolar disorders. You have probably used the phrase, "I'm not in the mood for anything today," or perhaps you have encountered someone who you consider to be quite moody. This person's mood may have varied from sometimes being energetic and cheerful to becoming grumpy and giving you the cold shoulder at other times. But what does mood really mean? According to the definition of the American Psychiatric Association, mood refers to any short-lived emotional state, usually of low intensity, for example, a cheerful mood or an irritable mood. In other words, what sets moods apart from emotions is that emotions are directed towards a specific object or phenomena, whereas moods lack such direction. For instance, you may say, "I'm angry at you," or "I'm proud of myself," when referring to an emotion, whereas when describing a mood you would simply say, "I'm cheerful today," or "I feel irritated," without specifying the object or cause. Our mood keeps changing all the time, around the clock, and that's completely normal. There are times when we feel vibrant and cheerful, while at other times we may experience fatigue and a lack of energy. We can find ourselves feeling happy at one moment and then overwhelmed by sadness at another. But when does it cross the line into abnormality? When can we say that a mood state has developed into a mood disorder? We can identify a person as having a mood disorder when their mood states become significantly more intense and last much longer. It reaches a stage where it interferes with their daily functioning, for instance making it difficult for them to maintain productivity at work, efficiency in studying, or to fulfill their role as an emotionally supportive partner, family member, or friend. Depression and bipolar type 1 and 2 are among the most prevalent mood disorders. According to the 5th edition of DSM, each of these mood disorders has its own diagnostic criteria. However, they consist of similar components. If we envision these disorders as separate buildings, the components are like bricks used in their construction. There are 3 types of bricks known as mood episodes: depressive episode, manic episode, and hypomanic episode. A depressive episode is characterized by a continuous period of 2 weeks or more during which symptoms of depression are present most of the time. These symptoms include sadness and a persistent depressed mood, loss of interest or pleasure in most activities, changes in appetite resulting in significant weight loss or gain, insomnia or hypersomnia, restlessness or feeling slowed down, observable reduction in physical movement and a slowing down of thoughts, fatigue or loss of energy, feelings of worthlessness or excessive guilt, difficulty thinking, concentrating or making decisions, recurrent thoughts of death, suicidal ideation or suicidal attempts. Another type of brick is called a manic episode, characterized by a distinct set of symptoms that persist for at least 7 days. These symptoms include exaggerated sense of self-importance and self-esteem, often accompanied by grandiose beliefs or delusions of grandeur, decreased need for sleep, and feeling rested with only a few hours of sleep, extreme talkativeness, feeling compelled to speak rapidly and excessively, racing thoughts with ideas jumping from one topic to another, easily distracted, finding it difficult to concentrate or to stay focused, restlessness, or an increased involvement in various social, educational, occupational, and sexual activities, engaging in risky or reckless behaviors with potential negative consequences, such as excessive spending, reckless driving, or impulsive sexual encounters. The third type of brick, known as hypomanic episode, is similar to a manic episode but milder in intensity. It lasts for at least 4 days, but never reaches the duration of a full 7-day manic episode. It's important to note that during a manic episode, there is a higher likelihood of requiring hospitalization due to the severity of symptoms. In contrast, with a hypomanic episode, the symptoms are not severe enough to require hospitalization. Now that we have 3 types of bricks, let's use them to construct the different mood disorders. Major depressive disorder, which is the most common mental disorder, occurs when a person experiences 1 or more depressive episodes. It's important to note that during periods of depression, the person may not experience depressive symptoms continuously, and there are times when their mood returns to a normal state. However, the presence of even a single episode of mania or hypomania excludes the possibility of a diagnosis of major depressive disorder and raises the potential for a diagnosis of bipolar disorder. For bipolar 1 disorder, the only brick required is a manic episode. Despite its name, bipolar I disorder does not necessarily come with the presence of a depressive episode. However, it is common for people with bipolar disorder to experience depressive episodes alongside manic episodes, and they may even experience hypomanic episodes. In the case of bipolar II disorder, there are two bricks: one or more depressive episodes and one or more hypomanic episodes. A manic episode is not present in bipolar II disorder. Just like depression, there is a common misconception about bipolar disorder that people who suffer from it are constantly experiencing severe ups and downs in their mood. The reality is that they experience normal moods between their episodes. It could take weeks, months, or even years for the next episode to occur. Symptoms slowly appear and worsen over time, making it difficult to determine the onset and offset of an episode. And that's why the diagnosis of bipolar disorder is challenging. Some people may go undiagnosed for even 10 years before it's detected, while others may receive incorrect diagnoses for an extended period before finally receiving the proper diagnosis and initiating appropriate treatment. Another myth about bipolar disorders is the belief that bipolar II is a milder version of bipolar I. In fact, there are significant differences between the two that have led healthcare professionals to classify them as separate diagnoses. As mentioned previously, mood disorders are highly prevalent, with depression being particularly common, earning it the nickname the common cold of mental health. The good news is that there are various treatment options available for managing these conditions. While therapy may be sufficient for mild depression, in the case of major depression and bipolar disorders, treatment often begins with using antidepressants or mood stabilizers to control symptoms and enable the patient to engage in psychotherapy. Numerous studies have indicated that an earlier onset of depression is associated with a higher frequency and greater severity of depressive episodes in subsequent years. Also, those with early onset depression have a higher risk of being diagnosed with bipolar disorder later in life. Despite numerous research studies, the exact underlying causes of mood disorders are still unclear. It is evident that genetics plays a significant role in the development of bipolar disorders. The first episode of mania often occurs during the early 20s, where stressful environments trigger the manifestation of the disorder in those who are genetically prone to it. Given the important influence of genetics, treatment for bipolar disorders often relies on medication, and it is crucial to continue taking prescribed pills to effectively manage the disorder. If you find yourself experiencing symptoms of mood disorders, the best course of action is to reach out to a mental health care professional. It can be of help to you and those around you.